Okay, well, it's so fun to be here. Thanks a lot. I really enjoyed meeting with, I think, many of you just a little while ago with the graduate research fellows and talking with some of you earlier in the day and more later in the day. And it's nice to see old friends in the audience, too. I want to talk about some work that's very much in progress with my colleague Kristen Harknett, who's a sociologist at the University of California, San Francisco, and my collaborator really on all the work I do through the SHIFT project. This paper is a little bit of a departure from some of the work we've been doing over the last several years. A lot of our work has been focused on understanding the nature of precarious work in the service sector and the consequences of exposure to that precarity for workers and their families. This is a little different. This is really trying to understand much more of a sort of firm and policy interaction process that may alleviate some of the precarity that these frontline service sectors workers face. Because, as you know, a massive sort of transformations over the past several decades in the United States and around the world have really led to an increasing precarity of work. Financialization, globalization, now that I'm not at Harvard, I can say neoliberalism, have really reshaped the fundamentals of work, of working life. There has been, as political scientist Jacob Hacker says, a great risk shift from institutional actors like governments and firms to individual workers and households. And this has resulted in a growing precarity in general, but also a real polarization of work between professionals, those with college degrees, and many frontline working people with lower levels of educational attainment who face a real basket of precarious working conditions. For the folks who work hourly jobs in retail stores, in grocery, in big box, in fast food restaurants, workers contend with low wages, as well as with unstable and unpredictable work schedules and volatile work hours, often with little access to paid time off or paid sick days or paid family and medical leave. And while much of the focus is on wages, large literature has grown up over the past several decades charting these varied dimensions of job quality that seem to characterize contemporary precarity, particularly in service sector jobs. From low wages to non-standard, inflexible and unstable schedules to a lack of access to paid leave, which I think has come particularly to the fore during this COVID-19 pandemic. So what restrains this sort of inevitable downward slide to precarious conditions? Well, at the federal level, there are two important laws. One very long-standing, the Fair Labor Standards Act that governs minimum wages and overtime pay, and one somewhat more recent, the Family and Medical Leave Act that provides for job-protected leave for certain qualified purposes for certain workers. But there is no federal standard that requires paid sick leave, more stable or predictable schedules, or paid family and medical leave. In the absence of this federal legislation, what we have seen over the past several decades is a real sort of progressive federalism, in a way, of cities and counties and states passing their own labor standards that raise the floor, that adopt a higher labor standard when it comes to minimum wages, secure scheduling, break laws, like in California, paid, not just family and medical leave, but paid family and medical leave, and paid sick days. And these have really been increasing over time. I think this is from a now a little bit dated EPI report charting the number of state minimum wages that are above the federal. Yes, you're right. This is both a function of what states have passed minimum wages, but also of how if those state minimum wages are inflation indexed and how the federal minimum wage changes. But in general, more over time. For paid sick leave, really more. The share of workers who are covered by a state or local paid sick leave mandate has increased significantly over the last 10 to 15 years. Almost a quarter of workers work in a jurisdiction with some such law. So what are we doing? What is San Francisco, New York, Rhode Island, and Seattle doing when they pass these labor standards that raise the floor more than the federal standard or take the place of an absent federal standard? Well, one perspective is that there are direct effects of these kinds of local and state standards, and the other is a kind of more optimistic, grandiose version of a sort of laboratories of democracy in the famous turn of phrase, that the state experiment might then inform federal adoption. And we can see these two perspectives, pretty clearly in public statements and in the research literature. So here we have Mark Levine, then Manhattan Borough President back in 2014, sort of exulting in the passage of New York's paid sick leave law. He's blah, 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 blah. The city's lack of paid sick leave disproportionately affected low-income workers, minorities, and women. Now, all New Yorkers can rest assured that a sick day won't cost a sick day won't cost them their wages of their job. All New Yorkers are going to have this benefit. The direct effect, we've raised the floor in New York, New Yorkers will benefit. And there's been research that examines the effects of the passage of such state and local paid sick leave laws. I think this is a study by Nick Zebarth and colleagues. And it estimates that this kind of works. That when you pass a law, more workers report having access to paid sick leave. The number of paid sick leave hours taken goes up. There are direct effects of these local standards on those covered workers. But I think in the more ambitious vision, these laws don't stop there. That instead, these laws are a kind of testing ground for what can ultimately be federal action. That either variation in these policies or simply the presence and the effectiveness of these policies will inform and inspire federal action. That this is kind of the genius of the federalist system, that states can take this innovative action and it can then inform what the federal government does. Wisconsin knows that story well from the welfare reform era, right? And studying the state welfare waivers and state welfare experiments and ultimately leading to PERORA. So we see that articulated in the area of labor standards as well. The National Partnership for Women and Families will work to ensure that more cities and states follow, and that the new Congress considers paid sick days legislation next year. San Francisco is paving the way for change the country urgently needs. Scott Wiener, now famous for apartment buildings at BART stops, good, says, we can show California and the rest of the nation what we need to do to support our families by San Francisco passing paid sick laws. And indeed, I should say you should interrupt me if you would like to, or you can wait, whatever. At the federal level, we see that effort. That there has, we have seen paid sick days pass, we've seen them work to some extent, and so we should have a federal standard. And Congresswoman Rosa DeLauro of Connecticut and Patty Murray have introduced the Healthy Families Act to provide this. They have introduced the Healthy Families Act in every Congress since 2004. The laboratories of the states is not working, really, when it comes to labor standards. We have not, even as paid sick leave laws, paid family medical leave laws, and now secure scheduling laws have been on the books for a while, we do not see really this large-scale diffusion through federal action. And instead what we see is really a patchwork of these labor standards confined basically to the coasts. This is a map of paid sick leave legislation, I think, as of 2021, where, large liberal coastal states have adopted these laws, and much of the rest of the country has not. In fact, if we were to update this map, these dots would disappear, not that one, but these ones would disappear, because Texas, like many of these states, has not only not adopted paid sick leave laws, they have preempted any states or localities within their borders from enacting paid sick leave laws themselves. And so these county paid sick leave laws are actually no longer on the books in Texas. So when human resource managers and when the Chamber of Commerce and when others look at this, they bemoan a patchwork of legislation that imposes unreasonable costs on business. That this is difficult to comply with, that it's sort of, we need a single federal standard or really nothing at all. That this is an untenable situation. It continues to give employers headaches. That's possible. But what I want to sort of argue today and show you some evidence that maybe will convince you is that there's another possible outcome of this kind of policy patchwork. And I'm going to make the case to you that one thing we could be seeing here is that given the multi-state nature of many large service sector employers, we might see a kind of positive spillover effect within these employers, such that workers who aren't required to have paid sick leave may get paid sick leave benefits in non-covered states. That employers who have to comply with laws in some places may be more likely to offer paid sick leave in all places, for instance, or higher minimum wages even. in all places in order to simplify and perhaps equalize their labor standards even when not required. In some sense, what this is an application of what's a familiar sort of popular talking point about the spillover effects of state-specific laws to broader markets. We hear about Texas setting content standards for textbooks in a way that seems to shape the content of textbooks in other states around the country. Apparently this is not true. But we hear about it. But apparently what happens now is that custom printing is so possible that there's just different content, and content is just taken out. There are blank spaces in textbooks that did have like sort of more objectionable content in Texas. But anyway, the idea is out there, and it could totally be true. What is perhaps more true is the California emission standards, where California as a state obtained waivers to be able to set higher emission standards for vehicles sold in California. California is such a large market. The cost of making different cars with different emission standards is significant enough that essentially they set a spillover national standard. Texas would like to have more polluting cars, but we have this negative spillover from California. California would like to have more progressive textbooks, but oh no. Okay, so could the same thing be happening for labor standards? Could we see this a kind of job quality spillover through a similar mechanism? We don't know a ton about this, but there are a couple of analogs that I think give us a sense that this might be possible. So one comes from the union threat literature, where it appears that establishments operating in places where there is a sort of the threat of unionization of their own establishments may raise job quality in order to sort of head off that unpleasant possibility. We see some evidence in the minimum wage literature, although this is really mixed actually, that firms on the other side of a border, so firms that are adjacent to a state with a higher minimum wage may also raise their minimum wages, perhaps through a sort of market competition mechanism. If workers can easily work on either side of the border, the firms in the non-regulated side of the border need to keep up by raising their wages. Dubé et al. Don't find much evidence of that. This much more recent paper does find some evidence of that. And then finally, we have a sort of long-standing literature across some social science fields on home and host country effects. Here, the idea is that a firm who is homed in a sort of nation with higher labor standards and a sort of more like worker-friendly set of cultures may actually enact those practices even in the other countries in which it does business, even though not required by law to do so. But we're talking about something a little different. We're saying, could the enactment of higher labor standards in certain cities and states within this country shape the labor practices within a firm in non-regulated jurisdictions? And I think there's a couple different mechanisms that might make this so. So one is that large multi-state employers are setting wages, making schedules, and implementing paid sick leave policies within sort of complicated HR management systems. They might be using Kronos or Dayforce or other human resource management software that is not necessarily easily tailored to have very different parameters in different jurisdictions. And so there may be some real administrative simplification to just having one set of standards, one paid sick leave policy that you enact across all the places where you do business within your firm. The other possibility is that firms may not, we talked about this earlier, but firms may adopt a low-road practice because it seems cost savings and good for business. But if we are to believe advocates of the high-road strategy, folks who endorse high-performance work systems, or folks like Zeynep Tom who point to the business case for the high road, it may be that when firms are forced to adopt high-road strategies, a higher minimum wage, paid sick leave by local mandates in some places, they come to see. There is a kind of within-firm education process where they say, oh, this is actually quite good for our firm. This reduces turnover. This makes for happier, more productive workers. Perhaps we ought to implement this more broadly. And then finally, I think another possible mechanism, and I'm not going to test any of them, is of horizontal equity, that workers may know what those at other establishments in the same firm are getting, and it may be kind of awkward and bad for management and labor relations to have really different labor practices around paid sick leave or scheduling in different jurisdictions, even as required by law. I mean, maybe, but maybe not, right? Because particularly in the service sector, what I think the dominant consensus is that this is a sector really obsessed with minimizing labor costs at all costs. That labor costs are a significant input for service sector firms, which often run on tight margins, and they do all they can to take those costs down to as little as possible. We see that in low wages, for sure, but we really see it in unstable and unpredictable scheduling practices, where firms really try to very closely align worker staffing with customer demand. They don't want anybody on the floor who's not needed in the moment. They send people home at the last minute. They call workers in rather than schedule them on spec. And this is all an effort as part of labor cost minimization. The idea that firms would then voluntarily adhere to a more generous labor standard when not required doesn't really jive with that reality of service sector management. I think the other reason not to expect this is that even when firms are required to adopt certain higher road labor practices, they often don't. There's widespread non-compliance with state and local labor law, even with federal labor law. It's not a large literature, but there's a literature that looks at wage theft, which is an example of this non-compliance, and there's also a literature that looks at the effectiveness of secure scheduling laws. In our own work, we find that Seattle's secure scheduling law did lead to more schedule stability, but we were far from 100% compliance with the law. In Oregon, a team of scholars, including Lola Lustinu, who's now a new assistant professor here in the School for Workers, did qualitative work showing really limited compliance with Oregon's law. Yes, thank you. Great.
So you're characterizing basic leave and things like that as labor standards, but you could also think of them as benefits that the employer provides. And so I'm wondering if there's a parallel literature of other benefits like health insurance or pension that are there spillovers there, or are there legal reasons why you can't do that for that thing?
Yeah, it's a good question. Do you know? I don't know.
Well, I know so for retirement benefits, you have to provide it for everybody in your firm, but I don't know if
Interesting.
that's like your establishment.
Yeah. Oh, that's a great point on retirement. Yeah, I think we did see a couple of, San Francisco had a city mandate around providing some health insurance benefits pre-ACA, but it's essentially obviated, my impression, by the ACA. There may well be other examples of those kinds of state and local employer health insurance mandates, right? It's a mandate on the employer. Like in this sense, paid family medical leave laws are not a great example because they're actually not really employer mandates. They're generally state social insurance benefits. Are there other health insurance mandates like that? There may be, you probably know, but I don't know of others. The pension space is interesting. Yeah, so it's a good question. I'm not sure. I'm on the hunt for, as you can see, I'm on the hunt for analogs because I don't find a lot of direct evidence on this. So that could be really helpful. Yeah, Jeff.
You have not, at least not yet, mentioned another standard way that I think political scientists think about policy transition across jurisdictions, which is through these sort of formalized organizations like the National Governors Association and the American Legislative Exchange Council, where people come up with standard legislative templates and
Absolutely.
They chat about, why is this good, why is this bad, they share experiences across
Yeah.
Is that not something that's happened in this context?
No, it's a good point. And I think it absolutely has happened in this context to some, that isn't quite saturation, but it's not that far off given a highly polarized political environment. So, I think what we see is that, paid sick leave laws are very homogeneous in their wording. Secure scheduling laws there's not that much, there's some variation exactly who was covered and exactly how many weeks, but they're a pretty standard legislative template for sure. And so the kind of states that are likely to adopt those laws there is that kind of diffusion, but it's circumscribed politically, essentially. We are not going to see paid sick leave or secure scheduling in Oklahoma in this current political environment. And nor do we apparently, given recent legislative history, are we about to see the Healthy Families Act adopted at the federal level. Yeah.
So you've contrasted the alternatives of like a positive spillover effect or no spillover effect. It seems like there's also the possibility of a negative spillover effect where maybe you're going to get to this, but I'm having to pay these benefits in this jurisdiction. Maybe I'll remove some benefits from my workers.
Oh, wow. Great. I'm going to do that. Yes, I don't do that. No, I hadn't thought about that. So one way to think about that is there's It's like a between worker compensating differential. Like if I'm going to have to pay you people more, then I'm going to pay you people less. I think the other possibility, and we don't look at this in the paper either, but it was on my list and I kind of forgot about it, was we might expect that a higher labor standard might, in a set of places, might lead to more adoption in the other places for that thing, but less of some other thing everywhere. So okay, fine, we'll do paid sick leave for everyone everywhere, but everyone's getting a 10 cents less. And that we can look, I'll get into the empirical strategy. We can look at that and we haven't. But I like this third, that's good. That's good, because what I'm going to argue to you is that actually what we see is a kind of positive spillover. That there are these two possibilities. Maybe there's a third also. The one possibility is that there's mandate spillover, that firms, for reasons of equity, for reasons of a learned business case, for reasons of administrative simplicity, whatever, adopt the higher labor standard even in places where they're not required to, that there are these spillover effects of labor standards to other jurisdictions that don't have these laws. The other possibility is that they definitely don't do that. That these are firms that are resolutely committed to low labor costs and honestly not to particularly high levels of compliance even when they have to, or maybe even that they take it out of workers in other places that don't have mandates because they have to give this costly benefit to workers in places that do have mandates. What do we know about this? I mean, I think the world knows something about this, but we academics know nothing about this in terms of what you look for in the academic literature. So, permit me to go outside of that a little bit. I mean, here we see the problem pretty clearly articulated in this Society for Human Resource Management sort of blog post. Companies must make a choice. Either pay everyone at the highest wage rate to ensure compliance with all laws, or set pay on a jurisdiction by jurisdiction basis. Either way, this can be hard to manage, Visconti says. For example, California alone has at least 20 different minimum wage ordinances depending on locality. So here the Human Resource Society sets up this problem. What do firms do? We don't know a lot about what they do, but one piece of evidence comes from the voluntary minimum wages that some large big box employers have set. This is a relatively unimportant figure from a Laura Derenicourt's paper about Amazon's voluntary minimum wage effects. This is just a descriptive piece, but it kind of illustrates our point that large firms like Amazon, like Target, like Walmart, like Target, like Amazon, like others, have set voluntary national minimum wages that are often just above the highest, maybe not DC, that's crazy, but just above the highest local prevailing minimum wage. Now that in effect gives workers in low cost of living places a really big wage increase, and workers in high cost of living maybe not so much, but there is an administrative and a PR simplicity in having a single unified wage that ensures broad compliance. We also see this around paid sick time in Starbucks. So as part of the union filings at Starbucks, Starbucks' extremely long employee benefit handbook came out and was posted online as a PDF. I don't think it was a super secret document, but that's how we found it. And in it, they describe their approach to paid sick leave. They say Starbucks partner and family sick time is intended to meet or exceed the requirements of all relevant federal, state, county, and local labor laws and regulations. And they have this helpful table where they say whether their policy is, whether there's a prevailing local mandate that they meet or exceed, or whether there's no mandate and their policy is then in effect and better. So Alabama, is there a mandate in effect? No. Are the provisions in Alabama more generous than our basic national standard? Of course not. How about Arizona? Is there a sick leave law in effect? Yes. Is it more generous than what we do nationally? No. Our policy will govern. And they go through this. What's the big exception? California. California does, in most states, if they begin with cities and counties passing paid sick laws, when the state passes a sick law, a deal is struck that it preempts the state and local mandates. Not so in California with paid sick. So in California, paid sick, these very innovative local policies that were among the first in the country to provide for paid sick leave still bind, even as there is statewide paid sick leave. And the companies generally do not adopt these standards nationally. These are sort of idiosyncratic holdout cases. But in basically everywhere else, Starbucks says that's what they do. And that's what Untuck It. No, I did not wear my Untuck It shirt today. I gotta wear the Untuck It, but then it doesn't tuck, and I look ridiculous. Okay, fine. I look like Lonnie. I don't look ridiculous. But we went to a recent webinar that this guy was a part of, put on by one of these human resource management software firms that Untuck is a client of. And he says, listen, the best practice is to accept whatever is the most restrictive policy as general practice. Outside of California, we apply laws equally across all of our stores, no matter whether or not we're required to do so by law. This has streamlined the complexity by ensuring that stores are adhering to a baseline of compliance. Yes?
Are you only talking about jobs where people physically have to be in the store, or how do you think about remote work and how this complicates this situation?
Okay.
Because even some of these retail places would have like online.
Yeah. Yep. Okay. Well, all right. So the easy answer is I'm only talking about in-person workers. Okay. But the more interesting, so from an empirical perspective, that's that. So these state and local laws are kind of interesting because, they cover workers who work in those places. Do most McDonald's workers in San Francisco live in San Francisco? I don't know. But I would imagine many do not, because it's an extremely expensive place to live. And so an interesting feature of these laws is that they are hard-fought legislative victories in many places, and they're not necessarily at the city and county level covering people who actually live and vote in those jurisdictions. They're covering the workers who work there. The law is attached to place of work. So when you're a remote worker, what is your place of work? I actually don't know the answer to that question. I feel like I should. Is it where you are living, or is it where your employer is homed? I don't know the answer, but it's a good question. Okay, so I want to investigate these questions kind of out of convenience in the context of paid sick leave, but not just out of convenience. Paid sick leave is a really important aspect of job quality. It has this really nice feature that appears to be good for workers and their families, but it's also really good for the public health. It's been a series of papers that show that the broadening of paid sick leave provision reduces the transmission of seasonal flu generally in the population. There's a paper last year in Health Affairs that showed that the temporary expansion of paid sick leave under the Families First Coronavirus Response Act reduced COVID spread. And that's because frontline workers who go to work sick, or go to the office sick too, spread disease to customers and coworkers. And this is particularly so in the service sector, in food preparation, for instance. But there's really limited access to paid sick leave, especially in the service sector, and there is no federal standard. The FFCRA was a temporary standard that only applied to workers at 50 to 500 worker firms and expired in December of 2020 or 2021? It expired. But what we have are 14 state and 24 local standards as of 22 that impose a paid sick leave mandate on employers. And they are structured as employer mandates, not like PFML as a sort of state system that you might access in part through your employer. Yes?
I'm wondering about the use of like contractors to try to get around these types of policies. The extent to which like
Yeah.
you just want to have an outside firm do the job so that you can avoid these requirements. Is that
Right.
how does that work? Like do these
So-
laws cover?
Yeah. No, it's a good question. So for paid sick leave laws are actually quite broad. Like secure scheduling laws are pretty narrow. They cover like certain large firms in certain sectors. Paid sick leave laws are in general, and they're generally all the same, are pretty broad in covering workers. There's not, accrual begins pretty quickly when you start your job. So it depends on the kind of contracting we have in mind. Like if you work for Securitas, you should be getting paid sick leave, even though you do not. Like if you're a security guard at Harvard, you are a fissured worker. You work for Securitas, who is an independent who's a contracting firm for Harvard, but you still should get paid sick leave under the state law. If you work at a franchise, you should still be getting paid sick leave under the law. If you are an independent contractor, like an Uber driver, you would not be getting paid sick leave under the law. That's one of the key problems of misclassification, is that you're not getting these labor standard protections. The firms I'm going to talk about just don't do that much of that in terms of that kind of independent contracting work yet. I mean, we'll see.
I remember reading about like hotels and like one of the cost-saving measures that some hotel
Yeah.
brands did during the pandemic was to like contract out some of their like cleaning staff.
Yeah.
But those staff like lost, like in doing so they lost, some of their job benefits.
And they may lose some of their job benefits if the company has voluntary benefits, like a better health insurance or a pension, particularly if it's a unionized company, that they don't, that their contractors are not required to provide and don't voluntarily provide. For these paid sick leave standards, they're pretty broad. The contractor would still have to do them if these are W-2 employees, not if they're independent contractors of your oh God, but that's totally possible. Okay. So these are the two ideas I want to try to test with you today. The first is that there is this mandate spillover. And the way we're going to operationalize that, and I'll describe it to you, is that when larger shares of a specific company's workforce are covered by PSL mandates by dint of their establishment and workers' location across the states, that will be associated with the company extending paid sick leave benefits to workers in non-covered places. This is a within company story. The alternative is no. That's not what's going to happen. That companies will only provide paid sick leave where they're required to do so, or maybe not even then. Company exposure to paid sick leave mandates not going to shape what they do for workers where they don't have to do anything. Okay, so this is actually a talk about data, all this stuff being said, and what I think is some cool stuff we've been able to do with the Shift project data. Because to actually test these ideas is a pretty demanding data task. What we need are individual level worker reports of access to PSL. I'm going to try to make the case that what we really need is to hear directly from workers if they feel they can take a paid sick leave day. And that's pretty different from when you survey HR managers and say, do you offer paid sick leave at your company? Both because workers may have different levels of qualification for paid sick leave based on tenure and hours, but also because the reality is that it's one thing to say there's paid sick leave and it's another to actually be able to take it. That is to not be retaliated against by your manager, to not get negative attendance points, to actually just be able to take it at all. Then we need to know where these mandates are in effect in a time-varying, place-varying way. And then finally, we need to understand firms' exposure to these mandates given where their establishments and workers are. Okay, how do we do that? In a couple of different ways. The first is that we're going to use individual level worker reports of access to paid sick leave from survey data with year, month, firm level, and geographic identifiers. Wow, that's so great. Where'd you get that? Oh, we got it from the Shift project, which is this large research project that Kristen and I run. So the Shift project is a large, ongoing, basically repeated cross-sectional survey of hourly workers at large firms in the service sector. And we get it in a weird way. Our sampling frame is essentially Facebook, and Facebook also provides our survey recruitment device. So we go into Facebook's targeted ad platform, and we identify workers who work at these large firms. You could use Facebook's platform to identify people who like Coke in Georgia. We're going to identify people who work at Subway or Starbucks or Gap. And then we use the targeted ad targeting platform to buy ads and deliver them to those audiences of workers on Instagram and Facebook. Ads that look like this. Current or former Domino's pizza worker? Yes, we think so. Take a short survey and tell us about your job. A picture of a guy who looks vaguely like he would be a Domino's worker, but no branding. Outlink to a Qualtrics survey. Chance to win a $500 gift card, true. Although it's very hard to give this $500 gift card away. People are like, this is surely a scam. But whatever. But we can give it away ultimately. And then people can comment and share the ads, very interesting. Folks who click, leave, they go to a Qualtrics landing page. We do not get any more data from Facebook. We don't get any data from Facebook. Facebook does not get our survey data. It's just the recruitment device. It's not a data source. People are asked to consent and then complete this survey. I can talk a lot more about why this data is a good or bad idea, but I'm not gonna unless you ask me about it. So I'll leave it at that. Okay. We've been using this approach for a while now. We are in the middle of collecting our 13th repeated cross-section of data. We began back in 2016. We collect this data twice a year from what we think of as a national sample of workers. These are workers who at every wave are employed at a core of 33 large firms and then a rotating cast of other firms for a total of about 150 of the largest retail and food service firms in the United States. We also embed geographic oversamples. We've primarily done this because we're interested in separate work in estimating the effects of secure scheduling laws in places like Seattle, New York, and Oregon. And then we have also embedded a set of panel surveys that we don't use here yet, where we take workers who come in at the baseline, like here's the panel 3 baseline, and then we re-interview them through email and text contacts on a sort of high-frequency, short-duration panel. Yeah, Jeff? Okay, fine.
What do you know about the selection process? So my daughter would say, oh, Facebook's for old people.
But
so you differentially
yeah, no,
there's requests to remove her Facebook page because it's horrible that you have her
yeah.
Facebook page.
Well, there's a really good TikTok of me. Take the survey. No, there's not. Oh, but that would be great. We are on Instagram in our defense. Yeah, I think, listen, I think there are serious selection. There's the risk of serious selection problems. And the selection process is multifaceted. First, who is on these platforms, Facebook and Instagram? Yes, I think this could always be changing. And there is constantly the sense that everyone is leaving Facebook because of various scandal or another. Pew does some overtime polling about who's actively using Facebook and Instagram. That number remains very high, according to Pew. Now, maybe young people that don't take Pew surveys either, they're only at 9% response rate. But if we go on that, this is a pretty consistent and high share of people who are on these platforms and active on these platforms. All right, then the second problem is, yeah, but who are we targeting? We're basically relying on this targeting attribute of where you work. We think it's a little bit of a black box, but we think that's basically a self-reported item. And we think from sizing those audiences relative to our estimates and size of these companies, about half of the employees of these firms can be identified as working at these firms on Facebook. But there could be non-random, there's surely not, and by firm, right? You might be proud to work at Costco, not delighted to say you work at Dollar General. A surprising note, there's too big an audience at Victoria's Secret. Okay, so, and Foot Locker. Anyway, okay, then there's like who clicks on ads. I'm not going to ask you to raise your hand if you click on ads, because I know what you're going to say. But lots of people click on ads. It's like a many billion-dollar business for Facebook. It still is, and but there's selection in that, and then who takes the survey. So what we have tried to do is there's no silver bullet for these problems. We've tried to come at it a couple of different ways. One is that we can compare the sort of observable characteristics of people who end up in our survey to who. It's hard to compare them to the true characteristics of this sample because we don't really know that. But we can compare them to other workers in the sector, in the CPS and the ACS, and they look too female and too white who take our survey. That's kind of true of surveys, but it's definitely true here. And we reweight. Everything I'll show you has been post-stratified and reweighted on age, race, gender, and education. But that doesn't solve our problem if there's some unobservable and who clicks on these things. We've done a couple tests to try to get at that. One is, I'm giving the long answer. All right, well, one is that we have tried to benchmark key associations in our data against other ones. And the one we've looked at most closely is the wage returns to job tenure. And the wage returns to job tenure, employer-specific job tenure in our data are the same as they are in the NLSY and the CPS. Okay, fine. So then why'd you collect this data? Because we're interested in other things that are not in the NLSY and the CPS. What can you do about that? Well, you can't do that exercise. But what we've tried to do is some more speculative stuff. So the risk here, not so much for this paper actually, but for other papers, is that people select into the survey on some difficult to observe characteristic that could confound the key association. So what we've done is run ads. We try to say, okay, so like what? Like maybe people who hate their jobs take this survey and every little thing about their job is a mortal insult to these people, right? Whereas people who love their jobs, they don't take the survey, but these things don't bother them because they're happy. So we have run ads that say, hate working at Walmart and love working at Walmart. And what you find is you get pretty different workers. Like these people are much more satisfied. But the association, for instance, between unstable scheduling and psychological distress is the same in these two groups. Okay, go ahead.
What fraction do you lose from 10?
We lose, I think, about half of people who get to the landing page and don't continue.
Wow.
The response rate is very low. It's about 1% of people who see the ad who contribute survey data.
How long is the survey?
Very long. Yeah, we get a lot of partial responses. That's a great question. So we see a significant survey attrition through the course of the survey. We do a couple different things about that. We can just look at the complete cases. We can impute for item non-response among complete cases. We do a pretty ambitious, let us say, imputation for this non-response among people who are trite. And those all generally give us very similar answers. But it's a real thing. Yeah. Yes.
This might be a bit of a silly question, but
No.
can we honestly trust that employees truly understand their paid sick leave policies? Especially based on the fact that a lot of these minimum wage companies have pretty high turnover.
Yeah.
So you have people coming in who have maybe not been there very long, don't know.
Wait. Let me come to that in 3 slides. I think it's an excellent question. Is that cool? Is that all right? Okay. Let me go a little more. So who do we get? We get workers at companies like these, like the strip mall, the mega mall. It's It's the large, name brand firms in the retail and service sector. In all, we have data from workers at about, 145 of these large firms distributed across these kinds of subsectors. And in all, we have data from about 160,000 hourly workers across these waves of the survey. And so what that means is we actually have pretty large subsamples of workers at each of these firms. That's an unusual thing in the US context, to have that kind of nested data structure where you can identify employer. And it's kind of what we're going to try to use here. We also ask workers if they have paid sick leave, to your question. What we say is, please look at the following list of benefits that employers sometimes make available to their employees. Which of the benefits on this list can you receive as part of your job at, whatever, Waffle House? This is the NLSY question, I believe. And the first one is paid sick days. Are we getting a useful signal with this question? And I think the answer is yes. What we see is first significant variation in the share of workers by firm who report access to paid sick leave. So we see that the share of workers who say, I don't have paid sick leave is about 90% at Dollar General. And it's about 3% at Costco. Kind of tracks our common sense understanding of who provides paid sick leave as well. Why would a worker say, I don't have paid sick leave? And I think there are a couple things going on. So one possibility is because the firm does not offer it, and they have accurately reported that. Another possibility is because the firm doesn't offer it to them, because of job tenure or hours level, and they've accurately reported that. Another possibility is the firm says they offer paid sick leave, but they don't feel like they can get it. When we ask in our data if people have been sick recently, large shares of people have been sick in the last month. So the need for it, unlike paid family and medical leave, for instance, is pretty widespread. And so when workers report that they can't get it, it's either because the firm doesn't have it or because they feel that they can't use it. When we ask workers who work sick why they did such a thing, they say either I didn't have paid sick leave, or they say, because I was worried about retaliation from my manager, or I couldn't find a substitute and that's my job to do, or I didn't want to burden my coworkers. These are all forms. I mean, some of those people may still say they have paid sick leave, but in some sense these are all reasons why, from a worker perspective, paid sick leave is not real. Let me do a couple more and then I'll come back to you. We also see that the measure responds well where we think it should move. So this is evidence from an evaluation of Washington State's paid sick leave law using this data, comparing workers in Washington State and comparison states. Washington State and comparison states. We see them sort of similar shares of workers with paid sick leave in the period before the law goes into effect, and then pretty pronounced divergence, with covered workers in Washington reporting much higher levels of access to paid sick leave. We see the same thing at Olive Garden. Olive Garden was pressured early in the pandemic to provide paid sick leave by muckraking journalist Judd Legum, and they did. It surprised us all. They are going along here not providing much paid sick leave, and then they do. And workers report, yes, I now have paid sick leave. And we see the share of workers who report going to work while sick declines at Olive Garden as a result, or at the same time, let us say. You have more on this?
No, I feel convinced.
Okay, cool. That's great. How are we doing on time? Like, what's the deal? It's 1. Okay, so we're okay. We're fine. Okay, yeah, go ahead.
Well, we're getting into geographic, so we need to hold on.
All right. Okay, so we know the firm you work at, and we know this measure of if you have paid sick leave, but we need to know where you work, because we need to know if you're covered by a paid sick leave law or not. How are we going to figure that out? We want to know not just where you live or where you are when you take the survey, but where you work, because that's what determines coverage per our earlier conversation. So we have a crude measure, and then we have like a very fine but complicated measure. The crude measure is we ask people what state they work in, and almost everybody gives us this piece of information. We also ask workers, like, where do you really work? Like, exactly. Like, what's your store number? Are you at Starbucks, 572? 128? And if they don't want to give us that, give us something. Give us a street, a city, a town, a state, a phone number for your store, anything. And then what we do is we need to match that to something. And what we match it to is scraped information from each of these companies' store web finder sites. And what's valuable about those is they often have store number. This is from when I gave the talk at Cornell. I apologize for not updating my store finder slide. Shit. Okay, it's fine. So here's Home Depot store finder. So we scrape this information. We've got a database of where stores are located and their store numbers and addresses. It looks like that. And then we match it to the micro level employee reports. Ideally, we have one-to-one matches using employer and store number. Or we'll take one-to-one matches using store phone number. or one-to-one matches using a single location in the geography. So you work at IKEA in Stoughton, there's only one. That's less common because there's a million Starbucks everywhere. And then we resort to string similarity matching, where we basically dump into a long string, at least we were talking about this, I think, earlier, everything we've got, kind of like store, street address, street number, county, and there's weird abbreviations. It's sort of horrible. Rather than try to harmonize that by hand, we're just going to take string similarity matches. This ends up being relatively little of the matching we do because we have this upstream stuff that we believe in more. So this is not quite the same data I'm going to use today, but it's a sense of it. So about of the 203,000 people, sorry, this is more up to date. So 203,000 people report on wages. We've got sufficient store location information, so the store number or the address. State we have for almost everybody, from about half of those people. So there's some selection process there for sure. And then we've got scraped company data for almost all of them. Some firms we haven't gotten yet. We can match store number on like a lot of them. Right? That's a very good way to do it for us. We can up that a little more with each of these approaches, such that we're matching about 92% of the people that we might be able to match. And then we fill in with the state of employment drop down for others, so that's not getting us county of coverage. And then as a last resort for the remainder, we are going to geocode their IP addresses and call that where they work. But it's not really, because the IP address is messy. Yeah, but it doesn't matter. So we can limit this, all the analyses I'll show you, to just the people who match on store number, to the people who match on anything, to the people with just state. It actually doesn't matter that much. Okay, then we need PSL standards by year month. This is comparatively easy. There's various databases that track the year month implementation of state and local paid sick leave ordinances. There's been some variation over this period. Michigan, Nevada, and Maine have paid time off ordinances, which are a little different. It doesn't matter. You can treat them as paid sick or not as paid sick or not in the denominator. It doesn't make a difference, really. And so we're going to match that to the individual worker locations to tell us if this worker is covered or not covered. And we're only going to look at the workers who are not covered in their year month of observation. And then finally, for the independent variable we're interested in, we need to understand each firm's exposure to paid sick leave mandates in their business operation. And to do this, we turn to the Reference USA database, which gives us, by paid subscription, another full roster of establishment locations, but without store number, but with an estimate of the number of workers who work at each establishment from phone survey. And so we can use that to say for Walmart, what percent of their establishments are in paid sick leave jurisdictions, what percent of their workers are in paid sick leave jurisdictions. And you see this kind of distribution of the firm's exposure by firm to paid sick leave ordinances, ranging from almost nothing. HEB is just in Texas and they don't have this. I mean, except for a couple counties, so maybe a little, to quite a lot of exposure for companies. So this is not random where companies are located. I'm going to wave my hands at that. Okay, great. I'm really not. We're not going to do much about that, honestly. I think it's one of the problems in the paper. Okay, did you want to jump in, Elise?
I was just thinking about when COVID hit, the data is covering that period.
The first part. It's up through 2021.
Yeah, so when COVID hit, the reactions were so different across states. And I'm curious about sort of, differential reactions by workers in terms of their fear of COVID.
Yeah.
And then the resulting need for more workers because there were shortages in places that it seems like was correlated where there was more concern about COVID and in places that were relaxed about COVID had
Okay, so
closed down, they had workers being part of an issue. And I'm just wondering if that's sort of
part of this.
think about that in the context of the adoption of these policies.
Okay, so on the policy adoption front, what we see is that some states that already had paid sick leave on the books pass slight temporary modifications to make them a little more generous. I'm kind of okay with it. We have a very simplified measure of yes paid or no paid sick leave. Some other states do pass paid sick leave for the first time, like New York State. Not a ton, but there's a little bit of that. I don't think the states that passed paid sick leave are surprising states. It's not clear to me that they wouldn't have passed it absent the pandemic anyway. But okay. The federal mandate does not apply to any of the firms in our data. The firms in our data are all very large, over 500. And so they're not affected by that. Could there be much more complex dynamics around like labor supply in places with and without standards and the need for employers to induce workers with, probably.
That's sort of what I'm wondering.
I haven't fully thought that through.
Shortages.
Like here's a crappy answer. You can run it on the pre-pandemic waves and it still works. But I totally hear what you're saying and I can't quite think it all through right now. Okay. All right, so what we are going to do is pretty simple after all this elaborate data construction. I'm going to estimate a set of models predicting whether a worker reports having access to paid sick leave as a function of their specific firm's degree of exposure to paid sick leave mandates at the time the worker is surveyed, conditional on the worker not being in a place that requires the firm to provide for paid sick leave. The data is multiply imputed for non-response and weighted to these demographic benchmarks. We've got a bunch of worker level controls for demographic and work characteristics. We're kind of controlling for that compensating margin with wages and hours, but maybe we should put that stuff on the left-hand side. I actually think we should, to see if there's actually employers are compensating. So that's a thing to do. And then we've got a number of state level controls in here. For labor market and policy environment and compositional factors. At the firm level, we cannot control for much. We do not have that many firm level time varying attributes, just firm level attributes. But we control for subsector and the number of workers at the firm, so size, although they're all large. And then state, year, and month fixed effects. Then I'm going to show you one other test. Same model setup, essentially, but we're going to stratify by whether the workers are employed at a firm that used a lot of franchising. And the reason we're going to do that is that while people differ on this, one school of thought says franchises just do what they're told. There should be joint employer liability. So a McDonald's franchise is wholly controlled by corporate. It's a fiction that they're a separate legal entity. We should hold McDonald's liable for wage theft by their franchises. We wouldn't see any difference between franchises and not. The other school of thought is franchises have some latitude, maybe not around how they make McFlurries or whatever, but like around their labor practices. And if that's the case, then at heavily franchised firms, this relationship shouldn't be very strong because franchisors do not have broad geographic exposure to some paid sick leave and some not paid sick leave. They own like 10 subways in Milwaukee. Okay. Is a crude measure for now, but we can do better. The crude measure is just if they're at a firm with franchising or not the extent of the franchising and not whether they themselves, the worker, are at a franchised establishment. But we should be able to have that. Okay, so what do we find? Ta-da! This part of the talk's very short. Okay, so what we find is that there is a pretty consistent and modest relationship between the share of your firm's workers that are covered by a mandate or the share of your firm's establishments that are covered by a mandate, either just looking at states and ignoring the county mandates or looking at both. For workers who themselves are in non-paid sick leave states, that's pretty robust across various different ways of specifying this model. It's true also when we use that really fine-grained information on exactly where workers work and look at workers who are not really covered by a paid sick leave mandate at the state or county level. This is like this is our preferred estimate over here, but it's kind of the same as all the other estimates. What does that look like? It looks like there's some substantive difference here. Firms who really have no exposure to paid sick leave mandates in their establishment structure, about 25% of workers in non-covered places say they have paid sick leave. Some firms provide paid sick leave, or at least provide sick leave to some workers. At firms who have a large amount of exposure, here 50%, which is about like the 90th percentile of this distribution. We do not go to, 100% is very unusual. We see that that's a significantly higher share, about 45 or 50% of workers in non-covered places that report that they have access to paid sick leave at their jobs. This is more, weighting or unweighting, clustering standard errors. It's a pretty consistent estimate. I also want to show you, and I think are interesting, are these results that stratify by franchise status. So I'll show you a chart in a second because I know it's hard. But the first one is taking only workers at franchised firms that franchise. Some of them may be at company-owned stores and some not. But these are firms that some McDonald's, Subway, Dunkin', a couple hotels, mostly fast food. And this is only firms that don't franchise. And what you see is a pretty pronounced difference in this coefficient. There's very little going on for the workers at franchise firms, and we see a slightly larger coefficient for those at non-franchised. But then most of the franchise food service. So a little weird comparison. So here we're just going to do food service, the franchise, non-franchise. So Starbucks, Dunkin', think about it. And there you see an even larger difference like this. So actually what's interesting is that these sort of spillover effects seem most pronounced at company-owned non-franchise fast food, pardon me, these most pronounced at non-franchisor fast food firms, but you see it at all firms as well. And you really don't see this going on at firms that franchise, we would argue, because that mechanism is not in play. Franchisors who may say set paid sick leave policy are not exposed to this patchwork. They do not need to harmonize it. They do not need to worry about equity among their workers and some other franchised workers. They do not learn the business case for paid sick leave. Okay, so let me just say what I just said. So we find that workers who are not required to have access to paid sick leave by law are more likely to report getting it when the multi-state firms they work for have greater exposure to paid sick leave mandates across their firm's business operations. There are some problems, that some of which are not very fixable. We have non-representative survey data that we've discussed. There's likely selection of firms with high road practices into PSL mandate states. Right now, the firm location data does not move over time. We have it at a single point. But it is possible to get it over time. And that should permit us to model where firms locate, and if there is that kind of bias, and also exploit time variation in the location of establishments, not just in laws. We argue that what we're seeing is spillover, but we're not able to test any of these mechanisms. We're not able to say that it is HR simplicity or equity or the business case. And PSL may be like the best case. Like, would we see this for minimum wages? Maybe not. Maybe that HR problem is easier. Maybe the costs of it are much clearer to firms. Would we see it for PFML? No, I don't think so, because it's not an employer mandate. Are there other cases around health insurance or pensions? Maybe. So they may not travel very far, even as I've tried to argue that this is a more general issue. Okay, the last thing I'll say is that this is like one of the things we're trying to do with the Shift project data, kind of a new set of work beyond schedules and well-being. We're also doing some ongoing work making use of this firm structure to look at how between firm segregation, not just between occupation or between industry segregation, may generate sort of categorical inequality by race and gender and parental status. We are looking at using the data we have from Starbucks workers and other fast food workers to try to model support for a union as a function of exposure to votes for the union at Starbucks. So to our other fast food workers who work near a Starbucks that organized, more likely to want to organize themselves. We are trying to use the firm structure data to look at how ownership structure shapes job quality. Do we see this financialization and shareholder value mechanism where, like, private equity owned firms may have lower wages or more unstable schedules? And we're doing a bunch of other stuff. Okay, so thanks to our team, including Connor Williams, who is a graduate of Wisconsin and of the concentration in research, and says hi, and a set of grad students and our funders. Thanks a lot. I'll come to you, but you've said.
Described a lot of this in the context of, maybe an accelerating job market, but not a hot job market. In the last 2 years, we've seen a hot job market, even among, at least if you believe the press, these kinds of jobs. Does that change the dynamic where you have workers who are no longer price takers, they're more selective?
Yeah. No, so I think it's a very complicated dynamic depending on the kind of aspect of job quality we're talking about. Clearly, wages have risen. Right, and even on an inflation-adjusted basis, it appears they have. Aaron Dubé and oh my God, his colleague, who's very famous at MIT, oh my God, what am I doing here? Have a new paper out showing an actual narrowing of the 90-10 wage gap because of the gains that basically these folks are making in the last couple of years. So I think the wage thing is real. How about on other dimensions of job quality? Scheduling is a complicated story. We haven't looked in the most recent wave, but we don't see any real change in workers reported. We see big changes in wages in our data. We do not see any change in workers reported exposure to schedule instability and unpredictability. Why could that be? One reason is that it turns out workers don't care about it, and we are wrong. Yep. Another possibility is that it's a really baked-in practice. And it is hard for employers to change this. We were talking about this earlier in the Graduate Research Fellows group, but many years ago, Walmart, that's not good. Walmart announced the intention to offer more stable and predictable schedules to all their workers, and they couldn't do it. I actually think they wanted to do it. They could not figure out how to do it in their software for many years. So it's hard to change some of these practices. They're very ingrained into business practice. Paid sick leave is interesting because companies are very reluctant to offer paid sick leave. They fought very hard against its inclusion in federal bills over the last year and a half or so. They offered temporary paid sick leave tied to COVID specifically that is gone in general. And short staffing, because of a tight labor market, actually makes stuff like paid sick leave harder for workers to use in a weird, perverse way, because they know if they call out, that's an even bigger problem than normal when you can't hire enough people. Now, could you hire more people if you offered real paid sick leave? Maybe, but like God, today there's not enough people. And if you call out, that's a big problem. And a big problem for your coworkers who you feel, so I actually think it's complicated. Yes?
Two questions. One, I was wondering if you have information on what the firms are offering beforehand. So it struck me when you used Starbucks as an example, which I think like probably lots of us in the room would think of those as one of the progressive companies,
Yeah.
A decade ago. If you worked at 20 hours a week or more, you could get health insurance, which was
very unusual.
Very
Absolutely.
So if there's variation in what companies or the firms are including in your analyses offered prior to the imposition of paid sick
Yeah.
leave mandates, it would allow, I think, at least a little bit of evidence of, is this about firms who would just kind of do the progressive
Right.
thing anyhow, or is this about the inducement from a mandate of companies who may not have otherwise?
Yeah.
I'm wondering if you had done that. And then the second question I had about methods was, Dollar General was mentioned, and you're talking about big box firms. In Costco, there's like a bunch of workers in an individual.
Yeah, great.
A dollar store, there's not.
Right.
And so this question, I think, really, totally agree that it could be that some workers you're asking are saying, no, I don't have it, when on paper they do, just
Right.
in practice they
Yeah,
don't.
yeah.
So if you threw out the folks who were in the smaller firms, which is where you would expect that to happen,
Yeah, smaller head
it
count.
might give you a little bit of leverage on convincing
On
people
policy.
more.
Yeah, on
So I was
policy.
wondering if
Great.
you had checked
Cool,
on those
cool.
two things.
Okay, so on the first thing, so certainly in covered places, we see firms responding to laws. So like the Washington State example that I showed you, we see that coverage goes up when the law goes into effect. That's a little different from what you're asking. You're asking, essentially, can you show us a much clearer before and after story to the spread of exposure to these laws? And the answer is we're kind of limited because our data on paid sick leave start in 2018, and a lot of these laws have been in effect for a while before that. And so we don't have a great before on all this timing. So I think that is a problem. It might be possible to isolate to a subsample of a lot of these firms are national, but some are not. So could we find some firms that don't do business in any paid sick leave place but Arizona? And then we'd get a before and after. Or don't do business in any paid sick leave state but New York, and then get a before and after, right? But because the laws are clustered geographically, and non-national firms tend to cluster geographically, it's a little, but we could look and see, right? So that might be one way to do it, is like a case study almost, right? Of a before and after for a set of firms that really have a new exposure to paid sick leave that we can observe in the data. That'd be cool. Second thing is a good point. We're controlling for total firm size, but we should control for average establishment headcount, which we have from RefUSA. So we could control for average establishment headcount. The problem, it would be a good proxy. Lots of people work at Dollar Generals, just not at the same time. So it's still different. Like Walmart has a headcount, a supercenter has a headcount in the hundreds. A Dollar General store is going to have a headcount in the tens, even if they never work at the same time, God forbid. So I think we get us something on that. That's a great one. Yeah, thanks. Long-time listener, first-time questioner? It's fine, okay. I'll go here first, yep.
You've gotten a little bit at this, but, and I'm thinking about the effects. So this is sort of harping again on my previous question of, potential negative spillover effects here.
Mm-hmm.
So I'm thinking about, even if there are positive effects on paid sick leave, that what, the full compensation package may be affected negatively.
Yeah.
I'm wondering if you feel like you have enough data to look at that.
I think we can look at it, and honestly, I meant to do it before, and then I forgot about it. But like, we can certainly look at wage. I think we can do it at least on a component basis. It's hard for us to price some of these things to put them all in one measure. But like, we can look at wages, we can look at hours, we can look at schedule instability, we can look at other fringe benefits. But it's a little hard to put it all together. But whatever. But we can do them one at a time. I think it'll be interesting. I don't expect to. But we'll see. Because in general, why don't I expect? No, I do expect to do it. I don't expect that we'll see it. Maybe I'm wrong, but the reality is paid sick does not cost that much. Like the estimates of the cost of paid sick on an hourly basis are like 5 cents an hour or something like that. So, okay, but maybe they make that up somewhere. And the other, we'll see. All right, no, we'll look.
To the extent that this is just a progressive company.
Yeah.
Then almost certainly you wouldn't expect it.
So maybe we want to see it, but then we don't really want to see it. All right, that's helpful. No, that's good.
So, I guess I was just wondering, like, do you have people in your sample, or like in the way you're sampling people, isn't it possible that they could be working multiple jobs at like some of these firms? And I guess I'm just wondering if you thought about that or had any
Yeah, okay.
any way to sort of ask sort of if they have multiple part-time jobs
Right.
at the firms that you're studying.
So I think, okay, yes, I hear what you're saying. So we ask people, like, where do you work at this, where do you work, essentially? We think we know where they work. And they,
Just ask like, where do you work?
and they tell us that. We also ask people, do you have a second job? And that's not that common in the data. I don't think people hold 2 roles at the same company. I think they work at that company, and that's what we're asking about. And then all these questions are in reference to that job. We say, at your job at piped employer, Starbucks, blah, 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 blah. So, but we could do a test where we exclude people who have a second job. And maybe that would help.
No, I guess I guess I'm a little bit surprised you say a lot of people don't have a second job.
I think it's very hard to have a second job at one of these jobs. Because these jobs are like, hey, we need you to be available anytime. Does anytime work for you? Okay, great. And you need to say that you have open availability to get hired. And then they mean it. So it's actually pretty hard to hold a second job because they really demand this.
Read stuff about teachers, like, teachers talk about.
Teachers have a very stable schedule.
Teachers have a stable schedule and then they get like a part-time job. So it's just.
Yeah. I don't remember what the number is. It's much higher than the general population. What's the general population 2-job holding rate? It's not very high. I think it's like 8% in our data.
This might be kind of wacky, but in thinking about magnitudes and mechanisms, I wonder if you could, if you said it was all about HR simplicity,
Yep.
and you took a cost of paid sick leave,
Yeah.
could you kind of do a back of the envelope calculation that says, here is how much HR simplicity is worth, given that, given this X cost of paid sick leave? Does that make sense?
Yeah. So if we imagine that this was like just a sort of like calculating cost savings thing, and that getting the systems to do this is costly, so they don't bother, or that there's ongoing labor associated with a kind of keeping a patchwork HR system. Given what paid sick leave costs, could you price it out? And then what you'd add to that is that some people say paid sick leave has business benefits, that you'll have fewer call-outs by other workers, and that your customers won't get sick, and then maybe that's good for you. Maybe you don't care. Maybe they don't notice they got it there. But so you might want to price those things in too. I'm a sociologist. No, that's good. Yeah.
Did you think at all about like shift managers seeing these ads on Facebook and telling people, oh, like, don't click on these? Do you have like
Yeah, Yeah, it's interesting. So like a lot of what people talk about in the comments are like, what is this? And people will be like, don't take it, it's management spying on us. And other people are like, no, it's not. It's fine. You can win an iPad or whatever it is. And so, you know, that we had a very hands-off policy for a while on that, because, like, you know, like it's like the 11th commandment: do not go in the comments, right? Like, so we didn't want to do that. But then we made an FAQ on our Facebook page that really tries to describe who we are and what we're doing. And we will sometimes now go into the comments to be like, hey, like that's not true. And we have some university branding, and so we really try to minimize that. We've gotten calls from company counsel various times to be like, what are you doing? And actually it's never really gone catastrophically bad. We generally say, we're a university outfit, we're not targeting you, and we are targeting them, but we're targeting lots of people, and we're not trying to call you out, we kind of are. But like, and then they're okay with it. They have been okay with it, the ones who contacted us. I don't know if there's any mechanism going on inside these companies where they've gotten wind of it. And like sometimes with the company councils, like they'll be like, I took the survey and then we can look and they took the survey and they're like, job title, company council. And they like take it as themselves. It's so weird. Anyway, okay. Yes, last question.
I was wondering about the kind of, if you saw any differences or if you looked at any differences by state. So I'm curious whether this relationship is,
Yeah.
in like Texas, it doesn't matter how much exposure they have to these laws
Yeah.
in other places because nobody feels like they can take
Right, that's interesting.
Yeah.
I have not. But yeah, looking at heterogeneity in the sort of worker side by some kind of contextual thing, maybe at the state level, or maybe by a worker characteristic. Like maybe this thing only works for, you know, white men. Maybe they're the ones who feel that they have paid sick leave, but not, you know, so that'd be interesting to look at too, actually. But I haven't done it. Yeah.
By parents.
My parents, yeah, maybe. Okay, should we stop there?
Let's thank Danny
Okay,
again
thank you.
for a lovely talk. Lovely, lively.